Over the last 3 years, we have worked together to help make London the healthiest global city. We're not there yet, and we are going to use Devolution as an aid to help us get there faster.
We know that when we plan and deliver services that some things get in the way. We have some barriers between how we work across the public sector. Devolution is around thinking through where those barriers might be, specifying those, and then having conversations with national bodies to really free them up.
It allows us all to work together locally to really focus on what our local population needs.
It will allow Londoners access to the services that they need and deserve. Devolution won't mean bypassing anything, and we're certainly not taking the N out of the NHS, but it will mean we'll be able to target things locally rather than them being decided by somebody in a remote office. The biggest barrier to devolution is the thinking sets we all have.
We're a very centralised country, but the national government have accepted that devolution should be part of any effective strategy going forward. So that's a huge benefit for the work that we're doing.
The mindset we would like to see is people working together in partnership with the right political engagement, but very much focused on the best outcomes for Londoners.
We have got pilot schemes in different localities being led by the people within those localities. The idea is to capture those developments, those innovations, and then spread them as quickly as possible to other places so they can benefit too.
In Harrogate, we're piloting new powers in order to help prevent health inequalities from arising in the first place. We're planning to use licensing powers, for example, with gambling addiction to limit the number of fixed odd betting terminals. Too often, licensing and planning regulations were taken at a central level. Now we can start to tailor what we do based on local needs and local demand. Devolution allows us to use powers to tailor services for local people working with local partners.
Within Lewisham, we've been running a pilot around devolution to really look at what gets in the way in our integration work across health and social care. Look at how we can free up those barriers and how we can talk to national bodies about how they can help us to really drive forward the outcomes and improvements we want to see for our Lewisham residents.
At the moment, we're piloting a few things as sort of proof of concept. There are lots of different contracts and different ways of procuring different things, and they can tend to get in the way of making local partnerships really work. So what we want to do is really set all that aside and start from the point of view of what's best for local people here.
The Hackney Devolution pilot is about bringing together health, social care, including public health, to make sure we have better services for the people of Hackney. What will happen is that the services in Hackney will work better together by making sure that they are integrated and think about the patient first and patient-centred. For instance, older people in Hackney will see health and social care work better together for them, delivering more focused services. Devolution breaks down the barriers that exist between existing organisations. That means where we waste time at the moment, we can now focus that money on services.
Our Devolution pilot is about having local control of the health and care estate, and we want to use that local control to speed up improvements to health and care services. Decisions around rebuilding hospitals, creating community health facilities, those can take a long time, and they're taken often by central government or national organisations. We want to make those locally in north central London. Devolution will enable London as a whole and the pilots, which are smaller parts of London, to make those decisions about their health and care services.
Devolution will help public services to work together.
Londoners will see a much more self-sufficient, effective and simple service.
Colleagues who work on the ground want to work together, and I believe they'll snatch the chance to do so.
I am optimistic that Devolution can help us make life better for London and Londoners.